We're here with Dr. Mehran Sadeghi from Yale University, and so you're delivering the cardiology highlights for this year's conference. Can you tell us a little bit about that and what's new and different from last year?
So this year we have about 120 abstracts that are presented, half of them as oral and half of them a poster. About 3/4 of abstracts are on the clinical side and 1/4 on the basic side. Interestingly, what we noticed this year is that we have less abstracts on, let's say, infiltrative cardiac disease. Much of the work in this area has moved to CE sessions, and this represents really the fact that these are now part of daily practice, becoming part of daily practice of cardiology. Also, in the previous years, there was a lot about new cameras, and again, these cameras are now used very routinely in many labs. So the abstracts this year are mostly on refinement of techniques that we have, molecular myocardial perfusion imaging, myocardial blood flow, and other applications. There are a number of abstracts on utilization of nuclear and molecular imaging techniques in advancing science, in pathophysiology of cardiovascular diseases, and some of them are very interesting and novel, establishing some new information about the role of inflammation in the heart disease, the interaction between heart and brain, and other things. And thirdly, we have a number of new tracers that are under development, and together combined, I think that this shows that we do have a very healthy pipeline of research in nuclear and molecular imaging, cardiovascular, nuclear and molecular imaging, and we have both some issues that came up in the previous years have now moved to the clinic, and new things are in the pipeline. So it really suggests that there is a very, very promising future for our field.
What do you think are the most exciting advancements in areas of research in cardiology, and what are the most significant developments?
So on the research side, last year we had, over the past few years, in fact, we've had a few new concepts that have emerged. Coronal expansion of hematopoietic cells and how they affect atherosclerosis is a very hot topic, and I think that it may change the way we see the disease. There are new developments in genetics. We have new now genes, and somatic mutation, how somatic mutation is involved in many cardiovascular diseases, I think is very important. At the same time, on the practical side, and a number of trials have established the role of inflammation in atherosclerosis and how anti-inflammatory treatments may change the outcome of the patients. We have new treatments for diabetes that change patient outcome on the cardiovascular side. And we also have on the imaging side, we have now new techniques that have moved to new tracers that have moved to clinical practice, and they are very, I think, excited, and they will change the way we practice imaging.
So where do you think we're going? What's next for cardiology in the next 20 years or so?
That's a tough question to predict. However, I think that big data, new sensors, new apps, getting a lot of information, and using imaging and especially molecular imaging data to develop a full picture of the patient is going to play an important role, and how we're going to analyze this data to sort of adapt treatment to individual patients rather than just giving the same treatment to a group of patients is going to be an important development. New phenotypes of the disease are going to be developed, so heart failure is not just going to be one disease but multiple diseases, and the same for atherosclerosis and arrhythmia.
Dr. Sadeghi, we really appreciate you sharing your expertise with us. Thank you very much for joining us.
Thank you, Wendy. Thanks.